the first part of your assessment is going to be getting the dog to kind of walk around so you can assess their gait. I recommend using a long line. If you're familiar with the dog and they're good recall, you could probably do them loose. We're looking for anything that looks funny, from limping to tracking incorrectly. So what we mean by that is one foot is a back foot landing where the front one left. Pretty much all dogs will land with their back foot just to the side. I'm just gonna go to the bathroom. Just to the side of where their front foot is leaving from. And in some breeds, that single track, it means exactly how it sounds. The back foot is going to land exactly where the front foot was. So if you could see it in like the snow or something, it would look like there was only one track instead of two. So that's how it gets its name, single track. We're gonna watch just kind of the dog interact with its environment. Look for any tightness or anything that looks restricted in movement. What I like about a long line instead of a regular leash is the dog can get out a lot further from you. So if you don't have help from someone, it helps get the dog away from you. Remember not to assess them when they're pulling on the end of the line. So like if she were to start moving around in a circle right now at the very edge of this line right now, I would not want to assess her gait at that time because she's going to be looking kind of funny because she's putting pressure on her neck and pulling rather than walking freely. You can also do an assessment of them coming to you. Bray! I don't know what you're eating over there. Bray! Found something to eat. Bray! No. Come on. Hi. Hello. Okay. Let's walk this way. See if I can get her to walk away from me. So I can assess. Kind of moving away. Here we got a nice little trot in there. Again, you don't want her to be on the end of the line assessing. Just move her around, nice trot, very fluid. Good girl. Keep moving. So ideally, you're gonna try and keep them moving for around 5 minutes. This is what we call active moving. So, oh, there she goes, body. Okay. You want to keep them moving. So what this is also doing, other than just being able to assess the dog, is you're warming up those muscles. And so what that's going to allow is that when you go in to do your evaluation, palpation, and stretch, the muscles of the dog are actively warm at that time, so you're not going to have to worry too much about accidentally tearing a muscle or hurting a muscle because it's not warmed up before stretching. You never want to stretch the dog on cold muscles, so that's why we kind of do this part. Gets the dog moving. You get to assess how they're moving. They kind of maybe get their little wiggins out a little bit before you try and poke and prod at them. She's moving really nice now. You can see she's a little bit more focused now. Getting her wiggins out. So then we can also get kind of a nice look at her here. The nice thing then also about these videos is you can get some snapshots from them that you can assess later. So you can take screenshots, see how they're looking, get some video of her walking away. She looks really good. I don't see anything that's super concerning. She's not limping. She's got a nice gait. Yes. Alright, so we're going to go in and do our palpation now. Okay, so at this point you've done your walk and your trot, and you're back in, and you're going to start going over an orthopedic exam and regular exam with the dog. You'll find that bigger dogs are a little bit harder to do some of this stuff with. You may need a little bit of help from the dog's owner. I encourage you to let the dog's owner participate if they're around. A lot of these things are just sometimes easier to get an idea of what you're looking at with some help. So what I like to do is I like to start at the front of the dog and work my way down. You're going to want to take heart rate, respiratory rate, and temperature at some point, but if the dog is really worked up and panting a lot, you're going to want to wait to do that until they're kind of at a more normal respiration rate, or else you're going to get some crazy numbers that are going to make you think the dog needs to go to the vet. So I'm just going to start at her face, and I'm going to work my way back. So what I do is I start with the gum check. So you're going to lift up their lip, you're going to look, and some dogs, they're going to have black and pink gums, or depending on their breed, what they got. But you're going to look for one of the pink areas. Hopefully it's pink. If it's any other color other than pink or black, so if you're looking at white or gray, that dog needs to go to the vet. That is could potentially be a sign of anemia. So you definitely want to get that dog into the vet. Something is wrong with the blood flow to that area, and usually is indicative of a medical emergency in many cases. So if you do see white or gray gums, that is, let's go see the vet. I wouldn't even continue at that point. Have the dog go get cleared by the vet. So now I've got vet stuck in my head. So the gums should be pink, or light pink. I mean, it's gonna vary a little bit, but you should be able to look at them and go, they're pink. Some dogs, they have really dark gums, so they have black pigment in there, so it's really hard to see the pink. Do your best, or just skip that because it's difficult. They should also be moist. They should not be tacky, and so you're just going to do that by, your finger shouldn't stick to the gums. If your finger is sticking to the gums, that's a problem. That's usually a hydration issue. Next, we're going to do a capillary refill, and by doing that, you're going to go find, usually above the canine, but in her case, she doesn't have very much pink above her canine. She doesn't like me sticking my fingers in her mouth, but we're going to find a pink section of gum, and we're going to press on it and let go. And the capillary refill is checking the dog's blood pressure. So when you press on that pink area, it should kind of depress the color down to white or gray. So don't count that as your gum test or whatever. But and then the capillary refill time is how long does it take for that color to return, and it should be less than 2 seconds for a normal dog. If it is more than 2 seconds, that is a sign that that the dog's blood pressure could be low, and again, I would have that dog get seen by a vet before proceeding, that there could be an issue with blood pressure or blood flow. Leaving Bray. Okay, so next we're going to do the, you okay? Yeah? Okay, next we're going to do the palpebral test. This is a neurological test, and I just throw it in there because it's super easy, and I'm already by their head to do it. So what you're going to do is you're going to take the dog's head. You're not going to poke them in the eye. You're going to tap the skin She doesn't even want me by her face now. You're gonna tap the skin right at the corner of their eye. And you can see she's blinking. You don't have to do it that many times or that often. Once is fine. You can see she's blinking. That's a normal response for this test. If they didn't have a normal response, they would just kind of almost be looking like they're staring through you. They're not gonna blink. So we're looking for, and you're gonna check both sides. You're just tapping the corner of their eye, not their actual eye, just the skin to the side, and checking for that blink. That is a normal response to that test. Okay? Next is looking for hydration, and usually this is done with the neck. So you're gonna just pinch their skin behind their neck and let go. And does it go back to its original spot, and how fast? The slower this return, the more dehydrated the dog probably is. So we wanna see that we're pulling up and it's quickly snapping down. That means the dog is under good hydration. So now I'm gonna work down the limbs. And the first thing I like to do, so you're gonna support the dog under the chest. This is where having a larger dog is gonna be a little bit more difficult, but you're gonna support them. You're gonna pull their front up and you're gonna touch their toes. And what we're looking for is the response to quickly put their foot back up. This is also a neurological test. It's one that I do because it's really quick and I'm already down there. That is a symptom, you know, like you can get ataxia from that. And so that's just, it's testing the dog's brain waves, brain communication to the area, proprioception almost, to say, hey, that limb, you're on the wrong side of it, we need to fix it. And sometimes when the dog is not having that communication to their brain, they'll have a delayed response fixing that foot. So you want to see a pretty instant response to that. But again, you don't want the dog to be bearing weight on it, so you're going to support them on the chest so that they don't fall over. You're just going to touch those toes on the wrong side, and you hope that they do that, which she does. So that is a good response. That means that we don't have any neurological dysfunction going down to this limb. Next, we're going to check her wrists, because that's the next thing up. The wrist should be able to touch all the way back to their forearm. So she's got nice, good range of motion there. When we move it back and forth slightly, there shouldn't be any clicking or anything in the wrist. Next, we're gonna go up into the elbow. They should be able to, you know, do some pretty good here. We like to see, she's very muscled, so it's hard to tell, but they should have at least one finger space in there. If they've got more than that, then they have a decreased range of motion. Then we're gonna go up to the shoulder. You can see she can pull quite a bit up here. She's pretty tight. She's got really good range of motion in this, this shoulder joint here. Again, when we put our fingers in there, there should be 2 finger spaces. You should be able to feel 2 finger spaces between the scapula and the ulna, okay? If there's more than that, then they've got a decreased range of motion in this joint. So you gotta pay attention to this joint, okay? Now we're gonna work on stretching. So when we're stretching a dog, first we wanna make sure that they're warmed up. That's why we did our walk ahead of time. There's other important things that go into stretching when we're looking at our dog, and one of the big things for the front limb is looking at the shoulder layback. Shoulder layback is where their scapula comes back. So you have this angle here. Shoulder layback is how far back their shoulder is. This angle is important when you're thinking about stretching. If a dog has a straighter shoulder, which means they don't have as much of a layback in their shoulder, they're not going to have as big of a range of motion in the front of in their front limb, which means they won't have as much reach as a dog that has a bigger angle. So it's really important to kind of understand these things before you stretch, because one dog's full range of motion could be here. and another dog could be way out here. So you can't go, oh, this dog, it only goes out to here. It's got major decrease in range of motion, because it might not. That might be how its shoulder structure is. So this angle here of this bone is going to kind of show you what their range of motion is. So like her normal range of motion, she should be able to go out at about a 45-degree angle, which she can, see? So if she didn't have that nice shoulder layback, and maybe her shoulder was more like this might be her range of motion. So this is something you need to pay attention to. The other thing to keep in mind is both sides should be even. So if one goes out further than the other, then you're going to start to see, okay, this is something I need to pay attention to. We have decreased range of motion. So for her, this is checking the tricep muscle here. She's got full flexion here. She's got nice range of motion. We want to make sure that we're keeping this limb parallel to the body. Remember, the dog's shoulder joint is not an actual joint. It's just attached by muscle. So it is not meant to come out laterally. It needs to stay medial with the body. You don't want to tear those muscles in there that are holding that shoulder. So make sure you stay parallel to the body when you're stretching the dogs. This is why I like to do it when they're standing. It's a lot easier to do. Larger dogs, it's hard because if you don't have the ability to stand over them very well, it can be difficult. I'm lucky she's a small dog, so it's easy to do that. Okay, so then we're going to check bicep, and we're just going to pull back a little bit. Okay, so when we check here, so even when we're doing our shoulder check, we're kind of checking the bicep, which is this muscle here. And sorry, I lost my train of thought. And so, you know, she's not reacting to this at all, so we know that that muscle is good. Then we're going to check kind of the pectoral and shoulder, and we're just going to kind of push back very slightly. You're not going to do this hard, okay? We don't want to force anything. And then I kind of stick my fingers up kind of in that area to see if I can get a reaction. She's really soft and supple in there, so she has no issues. If I was doing a full exam, I would do both sides. Again, you're looking for it to be bilateral, so you want it to be the same on both sides. But for the purposes of this demonstration, because I'm just trying to demonstrate it from you, I'm just going to do one side. But you want to do both sides, and you want to make sure that when you're doing stretching, they're going equal on both sides. If they're not, that's a good indication for you that there's something going on in one or both of those shoulders or triceps, whichever one you're checking at the time. Okay, so next I usually just take my hands and I make a C shape, and I go on either side of the spine, and I just run it down the spine. And what I'm looking for is they'll have like muscle twitches, or they'll twitch the skin as they're going down if they're having some sort of pathological response. So when you're going down, if you get one of those like muscle rolls or skin rolls, without not your roll, because you're gonna naturally kind of roll it a little bit, but if they react outside of that, that's gonna give you an indication that there might be inflammation in that area. So it's good to pay attention there. They might have a sore muscle, they could have something out of alignment that may need a chiropractic visit. But a lot of times if you're doing this test along the spine and you get that extra skin rolling, there's usually inflammation in the area that you saw that response when you were going down the spine. Next, we're gonna do similar to what she's saying, what is going on? We're gonna do similar to what we did in the front. So we're gonna do our neurological test. So we do the same thing with the rear, and see, she doesn't even like me doing it. So we know that she's got good response here, but I'm gonna try and get her to do it. So we're gonna put those toes just sitting there, and we're hoping that she does it right back, and she does, okay? So that's doing the same test as we did on the front, only with the rear foot instead. So You're just gonna lift the foot up and make sure you're supporting the dog so they don't fall over. We're gonna set it down. And you know, if they're fighting you like this, they've already got, you know, those good reflexes. So then you're gonna lift up on the leg, and you're gonna bring the hock up. You should have 2 finger spaces here between the 2 joints. You should be able to, you know, like flex this without a response. Shouldn't be any crunching or anything like that. Bring it up, you know, like these. Again, you know, she's pretty muscled, so it's, but you should have, you know, like 1, if you don't count the muscle, you should be able to fit, you know, a finger in there. And, you know, she can come all the way up. She's got very good flexibility. So some of these older dogs you're gonna see aren't gonna have that great of flexibility. You know, that's gonna be in your hip and your stifle usually. You're gonna see those issues. And so then we're gonna do a rear limb stretch. Again, make sure this stays parallel to the body. I like to kind of support the stifle and let them kind of support against me. A lot of dogs don't like to hold this one because they feel unbalanced. That's why if you can give them some support, they'll let you hold them there longer. But this is full range of motion. And this goes also to that angle, their angle, you know. So if the dog doesn't have much angulation in their rear structure, they're not going to be able to go that far back. But she has really good angulation, just like in her front. And so she can do a nice stretch. This is going to be checking like that iliopsoas, it's going to be checking the hips, and all these gluteal muscles in here. So she's really good, and she's nice and supple in that area. She has a really nice range of motion. Again, you're going to do this bilaterally, so you're going to do it on both sides. I'm not doing it for the purpose of this presentation, but for your assignment. And when you're doing work on client dogs, you're going to need to do it bilaterally. Again, making sure that both sides are the same. Okay? So now we can go through and do our palpation. I mean, she didn't have a whole lot going on, so it's really, you know, it's really hard to do that. But as you're kind of doing those range of motions, you're already kind of doing a lot of your palpation, you know. So if you found something that was, for instance, let's say on her front limb, she didn't stretch out all the way. Okay, maybe instead of going all the way out to her full range of motion, she only had half of her range of motion. That's the time where you can palpate that area and see if there's anything going on. So, okay, oh, yep, I feel it. That, you know, that tricep, it doesn't, you know, it feels really tight. There's a module there, there's a trigger point, something like that. So as you go through this range of motion, that's when you can do your palpation. If you want to wait to do the palpation until the very end, you can do that too. I don't care either way. It's all kind of a horse apiece. You're going to find your routine and what you like to do best when it comes to that. So now would be kind of a good time to take like her respiratory rate. So you're going to use a stethoscope. You can check how many breaths she takes per minute. You're going to check respiratory rate. You're going to check heart rate. And I won't require it, but you can also check their temperature. It's not a bad thing to get in the habit of knowing how to take the dog's temperature, which you do rectally. So you're going to need a rectal thermometer if you choose to do that. Hi. Yes, I knew you were such a good model. Yes, you were such a good model. All right, guys. So if you have any questions about how to do any of this, just let me know, and I will answer your questions as best as I can. But I'm hoping that this will help you as you move into your final case studies, and this will be required in your final videos for you to show this. So this is just kind of a step in showing us that you know how to do this before you get to your final exam, because you can miss things. And that's why we look at the gait, and that's why we palpate, and that's why we check the range of motion, because if we are just always going by what the owner is telling us is wrong, we might miss something because they might not be as, you know, in tune to some of those abnormalities.
puppies as we are. So we have to be the advocate for the dog. So the more that we can get our hands on the dog, show that we know the dog, any of that kind of stuff, those simple, super little details that we can catch, the better off we're gonna be for these animals. So if you have any questions, let me know, or else have fun doing your assignment.
I was going to show you another way to check the range of motion on the limbs. If you have a taller dog or a dog that's harder to stand over or anything like that, or if they prefer to lay down because they're a more arthritic dog or older dog, you can take your fingers and pinch the webbing between the toes, and usually what their reflex is to pull their arm back, and you'll see that kind of full range of motion in the limbs. So if I can do this without her being a turd. So see how she immediately kind of pulled all the way up. So now we can see, you know, the wrist is all the way up and her elbows all the way and her shoulders, so we can see it that way. You don't want to pinch too hard, you know, you don't want them to have like a fear or pain response. You're just trying to get that reflex. And then you can do the same with the back. Normal toe length or toenail length, okay? They shouldn't be touching the ground, okay? So even if they still click, as long as in a normal standing position, the nail is not touching the ground. This is what we want. So this is the palpebral test. It's hard to do with one hand, but you're gonna tap. See how she's blinking? That's a normal response. She just doesn't want me holding her face, okay? But that's a normal response. Okay. Gum color, you can see it's nice and pink. For a capillary refill, we're going to press our finger into the tissue, either on the gums or on the lip. And you can see how that kind of depresses the color, and then it comes back. So what you're counting is how long does it take for all that pink to come back, and it should be less than 2 seconds, as she is, as you can see.